Looking into the ethmoid bone, we'll start with the colored skull here. You'll notice that we can see a little bit inside the eye orbit. This part in the back here, so it's the medial portion of the eye orbit, this kind of pink color, that is a portion of the ethmoid bone. You'll be able to see more of that from inside the skull as well. So let's change over to the actual regular skull. Now looking at the regular skull, we can see a little bit of the ethmoid bone is hidden back here in the eye orbit. So you can see that's a little bit deeper in there on the medial side of the eye orbit. Now we're changed from this view because you can see a little bit here, but remember, skulls are three-dimensional, so we're going to change from this view and change the internal view of the skull from the superior angle. So switching that up. Now that we have this new view, you can see that we also have ethmoid bone right here. So this portion right here is in between this. This is the frontal bone on each side. We're looking only at this little bit inside here. You'll see there's a spike, which comes up here, some dots, and then a flat plane. So if I kind of tilt it a little bit, you can see that spike is coming up right here. So to orientate before we get into the landmarks, this portion up front here, this is the anterior side, and this back here is getting more of the posterior side going back in the skull. So we're focusing more on the front or anterior side of the skull. In the ethmoid bone, there is an ethmoid sinus. Now the ethmoid sinus is not visible in these plastic skulls. So just be aware that they are inside. The ethmoid sinus is inside the ethmoid bone. The cribriform plate. Now we're looking here, you'll notice I'm going along a flat area down here. That flat section is going to be the cribriform plate. It's the flat portion. Now, this cribriform plate is going to have a lot of holes punched into it. All these little dots you're seeing, all those dots are going to be the olfactory foramina. Olfactory foramen, basically. So you have the olfactory foramen, or olfactory foramina. The little holes are all punched and going through the cribriform plate. Now, right in the middle, there's that spike I pointed out. So right in the very center, so if I tilt this a little bit, again, you can see that spike coming up. That spike is going to be the crista galli. So this spike is the crista galli. The crista galli is right in the middle. So right in the middle of this plate, this cribriform plate. So 3 different landmarks, all located just here on the superior portion of the ethmoid bone. Now, next landmark, we have to change orientation. Now that we've changed orientation, you'll notice we're looking right in the nose here. Because in the nose, you're going to notice there's the middle portion right here, which is the nasal septum. But then on each side, you have these pieces of bone that are protruding up. So if I tilt that a little more, you can see it there. In total, there are 3 on each side. There's a superior, a middle, and inferior. For our purposes on the ethmoid bone, we're focusing on the top ones, the superior and the middle. What you're seeing right here, this one is a middle nasal conchae. Same on the other side. This one up here is a middle nasal conchae. Now this lower one, this inferior nasal conchae, that is something separate. We're focusing on this middle nasal conchae right up here. Now there is a superior one, it's higher up. You can't see it in this view or in this model, but there would be a superior nasal conchae as well. These nasal conchae, the middle and the superior, the nasal conchae are part of the ethmoid bone. And the last landmark we're going to cover on this is the perpendicular plate. Now you can notice you have the nasal septum right in the middle here. This nasal septum is made of two bones. This lower portion down here, that's actually the vomer. We'll talk about the vomer with the facial bones. We want to focus right now on this upper portion, the top half or the superior half of the nasal septum. This top half or this superior half, that is going to be the perpendicular plate. So if you look at that right in the nose, you're noticing this is the perpendicular plate, the top half of the nasal septum. That means you can see the ethmoid bone from inside the nose, inside the eye, as well as inside the actual skull itself. So several different vantage points to see the ethmoid bone.